As the current surge of new COVID cases continues, health officials say the number of cases is actually higher because of at-home testing.
But the question is how much higher, and that is not known. Our Joe Henke explains why.
Online and in stores, at-home COVID-19 test kits can be hard to find. They're often sold out. Results from these in-demand tests also does not show up in county or statewide data tracking the virus.
I sat there in my car in the parking lot of one of the Walgreens and just started calling various CVS's, calling various Walgreens.
Ashley Wagner of Woodstock recently tried tracking down an at-home COVID test kit for her daughter who was exposed to someone COVID positive and then days later on a weekend showed symptoms. She found a local pharmacy with tests in stock and her daughter tested negative. The following Monday, they waited in this line for an in-person test to verify the at-home test.
At least for us, it showed, that they are somewhat reliable, if not pretty reliable, because after we had the professional COVID test done, my daughter still tested negative.
Currently, there is significant community spread of COVID-19 statewide, but the true number of people with COVID-19 is actually higher for several reasons, including unreported at-home testing. A Georgia Department of Public Health spokeswoman tells 11 Alive at-home test results are considered suspect and are not counted by the state as confirmed cases. Individuals should receive confirmatory testing by a doctor, lab, or public health if they test positive on a home test, the spokeswoman wrote.
You want to make sure that you isolate for 10 days from the day that your symptoms started or from the day of your test result if you don't have any symptoms.
DeKalb Board of Health Director Sandra Valenciano says if you test positive at home, you should first isolate at home, away from others, and don't share household items. Second, let your doctor or local health office know so they can give you guidance. If your symptoms become severe, seek medical help. Third, anyone you came in contact with up to 2 days before your test, let them know of your positive test.
A really key piece is making sure that you did the test correctly, that you followed the instructions on the test, because there could be a case where you might be a false negative.
How to make sure your at-home COVID-19 test results are accurate, coming up at 6.